Hi, my name is Katie Lynn, and this is my Health Assessment 2 video. This is my patient Hannah. She's allowed me to call her Hannah. Before we got started, I washed my hands and obtained her vital signs. I'm going to start by just asking, do you know where you're at today?
Home.
And what are we doing right now?
Health assessment.
Okay, and can you tell me what day of the week it is?
Today's Tuesday.
Okay, so she's alert and oriented ×3. Her mood is appropriate for the setting. She's dressed appropriately for the assessment and for the season. Her vital signs were her heart rate was 62. Her blood pressure was 130/80. Respiration's 16. Her temperature was 98.7. And we used we got the pulse ox, and it was 99 on room air. And so we're good to get going with the rest of the assessment. Like I said, her mood and everything was good. Okay, next I'm going to assess her overall skin and nails that I can see right now. I can see that her skin is pink. She does have on the artificial nails, and her toes are painted, but if they weren't, I would be able to get a good cap refill bilaterally on each hand. Even though she does have the artificial nails, I can tell that she doesn't have any clubbing, no issues, no skin issues going on with her nails, or any cyanosis at her fingertips that I can see right now. Like I said, overall her skin looks good. She does have some freckles, moles. She does have a tattoo on her right foot, and then no obvious lumps or anything, and then I'll assess tenderness throughout the rest of the assessment. Let's see. Now I'm going to look at her head and neck. I can tell that her head is proportionate to her body, normocephalic. Her skull looks good, and everything on her scalp looks good. And just let me know if you feel any tenderness while I'm touching you. No tenderness, and I'll assess all over. Her hair is brown, it's thick, no oiliness, it seems dry, and no hair loss or anything that I can see. For her face, her hair and her eyes, nose, and lips are all proportionate to her face. I don't see any lesions, nothing like that going on. Let's see. And now I'm going to go down to her neck, and I'm going to palpate her carotids first, and then I'm going to listen for any bruise in her carotids. Okay, so I'll do one at a time. I'm just going to feel your neck. Okay, I feel strong carotids. Okay, and then I'm going to listen with the bell of my stethoscope, and I'm just going to place this on your neck, and I'll tell you what to do from there. So I'm going to turn it around here. Okay, and so when I place this on here, take a deep breath and hold it. Okay, you can breathe. I'll put this on. Take a deep breath and hold it. Okay, there you go. You can breathe. Okay. No bruise heard. Okay, and now I'm going to palpate her nodes, and you just let me know if you feel any tenderness while I'm doing this, okay? It's the preauricular, posterior auricular, occipital, tonsillar, submandibular, you still good? Mm-hmm. Submental, and then superior cervical, posterior cervical, deep cervical chain, and then the supraclavicular. Everything good there? No tenderness. I don't feel any lumps or any abnormalities. Okay. And then I'm going to move on to her eyes. I can see that her sclera is white. Pupils, just from looking, are good. Her eyes are hazel. Her eyelashes, everything, eyebrows evenly distributed. So now I'm going to use my pen light, and I'm going to dim the lights and just assess her pupils. Okay, Hannah. So you just pick a place on the wall and just gaze and stare at it, okay? And then I'm just going to bring this in from the side and assess your pupils. Okay? Okay. She had the Perla, pupils equal, round, and reactive to light. Okay, so I can turn this back on. If I had an ophthalmoscope, I would view her retina, trying to view the optic nerve, and then I would hold it in my dominant hand. And then I'm going to move on to her ears. They both seem symmetrical. I can see that she has one ear piercing in her tragus, that part of her ear, and then up here. What is it called?
I call it a cartilage.
Cartilage, piercing.
Yeah.
And so, any tenderness when I'm touching your ears? No tenderness. Just from assessing her outer ear, they look fine, normal, proportionate to her head. No obvious drainage or lesions. And then I'm just going to take a little bit of a look. Okay. And then bilaterally, just looking at her outer ear. Okay, no drainage or anything like that. If I had an otoscope, I would hold it once again in my dominant hand and assess her tympanic membrane and the malleus, and noting that it's shiny. And then for her nose, it's proportionate, even. I'll use this. You might just look up in your nose. No deviated septum noted. Okay, and then can you just occlude one of your nostrils and sniff? And then the other. Any trouble? Anything? So her nares are patent. And then her lips, they're pink, moist. Her mouth looks normal. I'm going to use the thin light to look at her inside of her mouth. Okay, I can view her uvula and tonsils. Her gums are pink and moist. Teeth, she has all of her teeth that she was born with. Okay, open your mouth again. And she has good integrity of the hard and soft palate, and her her tongue is normal. Okay, so that's good. I don't see any swelling. Her tongue is a little rough and beefy red in color. Okay, next we are going to move on to her thorax and lungs. Just from looking and assessing, while I was assessing everything else, I can tell that she doesn't have any abnormalities, no labored breathing. Her lung has good symmetrical chest expansion. Let's see. I can tell, like when I was assessing her clavicle, that her skin turgor is good. And then I'm going to assess and just listen to her lungs. Okay, so you can just sit there and you can breathe normal. And let's assess your lungs here. Okay, you just breathe. And then I'm going to go under your arm to the side. And you always want to listen to at least 2 places. Okay? Thank you. Okay. And then whenever we go to the back, I'll auscultate the back so you can see. Her lungs sounded clear. The vesicular breath sounds were heard in the peripheral lung field. I didn't hear any adventitious breath sounds. Okay, and then if you can, just go ahead. Well, I'm going to go ahead and listen to her heart while I'm here. And for her heart, I want to listen to the apical pulse for 1 full minute. And so I'm going to get my timer. I'm going to listen for 1 full minute. And then first, before I start, I will name off the heart sound areas. Okay, we're going to start with the aortic valve. It is on the second intercostal space, right sternal border. And the next is the pulmonic. It's the second intercostal space, left sternal border. Then we'll move down to Erb's point. It is the third intercostal space, left sternal border. And then the tricuspid is the 5th intercostal space left sternal border. And then the mitral, which is the apex, is the 5th intercostal space, like mid-clavicular line. And so this is where we'll listen for a full minute. Okay, so you can just breathe normal, just listening to your heart. Okay, and so for her full heart rate that I got this time was 68. So that's good. It's normal. It was regular rate and rhythm. S1 and S2 noted. No murmurs, no irregularities. Okay, so now if you'll go ahead and stand up before I have you lay down. And then just kind of turn to the side. I'm just going to show them the chest expansion that we discussed. And then, like as we're talking, you can see her spine is the normal S shape. There's no deviations with that. And then, and her chest expansion is normal. So now if you'll turn around, I'm going to show them and listen to your back. Okay? Lung sound. So you can just breathe normal for me. Good. Now I have to go one more lower. Okay, very good. Now if you can sit back and then you can lay down for me. So I'm going to assess her abdomen. Take your time. Thank you. Okay, and I'm going to get back behind the camera. Okay, so just obviously, I don't, her abdomen is flat. I don't see any pulsations on her abdomen. There's nothing different. We talked about her major organs before we started. And so then, if you'll pull your shirt up, we'll get started. And so I see just a small amount of striae, noted some 2 moles, and then just some freckles, like we discussed before. And you let me know if you feel any tenderness while I'm listening to you, okay? And so I'll start in her right lower quadrant and work my way up, listening to her. Okay, her bowel sounds were active in all 4 quadrants. Okay, and then I'm just going to kind of push on your stomach in some places. You let me know if you're tender. Let me know if you're tender in any place. Or if it hurts or just anything you feel. Okay, no tenderness noted. Okay. And then that's it with your stomach. So you can continue laying down, but you can pull your shirt down. And also a big important thing that I always kind of stress is the maintaining patient privacy. You know, when you've got them exposed in some uncomfortable areas, that's very important. Okay, and then while she's flat, I think this is a good time for me to assess her legs, and then I'm just going to feel all down your legs, okay? Mm-hmm. And so, no tenderness or anything. Her skin color is good and normal on her legs. And then, I do see a tattoo to her right thigh as well. And so, no edema noted. She doesn't have any edema in her feet, legs, anything like that going on. Okay, and so then I'm going to assess her dorsalis pedis. And so I'll run my finger down her big toe and feel. Oh, that's 2+. It's easy for me to feel. And then her tibial pulses. Okay, that's also 2+. And then maybe over here. No varicosity seen. Like I said, I would have assessed her toes bilaterally if she didn't have on the toenail polish. But as I can see, I don't see any cyanosis, any abnormal nail beds, anything like that. Okay, let me just make sure. And then when she sits up, I'm going to grade her radial and brachial pulses bilaterally. So if you'll just sit up one more time for me, we are almost done. Thank you so much. Okay. And so her radial pulse, I will feel right here on each. And so that's probably a 3+. It's very strong. And then her brachial. Okay. And then doing it on her right arm as well. The radial. And then the brachial. Okay, those are both 2+. Okay, thank you, Hannah. I really appreciate it. And so this is the end. And thank y'all very much.